thank you for the question, and I did do some research. The requirement would be that you would have one license for the LLC or whatever that entity would be, but you would have the fee and the license would be separated between each entity, so each one would stand on its own. So it would be $100 per establishment.
Thank you.
Any other questions, comments? Is there a motion? Is there a motion by Senator Roth. A couple of questions for Senator Hill. I know it's not germane to this committee, but there was a comment made by the BOE, I believe, that said that they would support if there was enough money to pay for the oversight of it. Do you have any idea of the cost of that?
We don't at this point, but we will look at that and work with the BOE to see what the number is and to find a way to make sure that that covers the cost of their involvement in licensing.
Okay. And obviously I supported the Leno bill as well. The difference is that the Leno bill deals with putting it into the Stake Act as well as saying that it's a tobacco product, whereas this is predominantly within the Stake Act. I'm going to support your bill, and for the main reason is because I believe in either instance, we have to make sure that, number one, it's licensed, it's an entity that needs to be regulated, but more importantly, that it needs to be out of the hands of children. And I think both of them address that, and that's my biggest concern. I believe that nicotine ultimately will lead to perhaps smoking. That's my personal opinion. But that's why I supported both. So with that, we have a motion by Senator Roth. Would you like to close?
If I could, Mr. Chair, just briefly, because we seem to get around the main issue is the definitional one that seems to be raised. And certainly the definition of 2010, now we're hearing that that doesn't work and we want a different definition. But it seems to me that is all related to and based on a national agenda to try and go a certain direction. Whether you call it one thing or whatever the definition is, this bill will prevent smoking, it will prevent access of e-cigarettes to minors, and more importantly, as it would be for whatever definition, it will prevent with the using the smoke-free laws, prohibit smoking in restaurants, prohibit e-cigarettes and vaping in restaurants, bars, the workplace, healthcare, hospitals, and all locations. So regardless of what you call the definition, this bill will move us quite a bit forward. Thank you. I respectfully ask for an aye vote, members.
Thank you very much. This is item number 2, SB 24, do pass as amended. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen.
Aye.
Nguyen, aye. Hall. Mitchell. Monning. Nielsen.
Aye.
Nielsen, aye. Pan. Roth. Aye. Roth, aye. Wolk. Wolk, aye.
Currently has 5. That's enough to get out. We have some members absent. We'll put that bill on call.
Thank you, Mr. Chair. Thank you very much, colleagues. Appreciate it very much.
Thank you. I think, is that Senator Cannella? Good afternoon, Senator.
Thank you.
How are you?
I'm doing well, Mr. Chair.
Good. All right. I don't think I've ever seen you in glasses.
It's late in the day. Eyes get tired, so.
You know, I think it's just you're getting old.
That too. That too. Well, thank you, Mr. Chair. I'm here to present SB 296, which will reduce billing documentation requirements that have become burdensome for both counties and providers of specialty mental health services. Counties and providers estimate that over 40 cents out of every dollar spent on mental health services goes to paperwork to document that the services meet billing standards. In addition, agencies report that when doing exit interviews with clinicians who leave for other types of employment, employers most frequently list paperwork as the main reason for departure. After review, it has been noted that our state guidelines on billing are not significantly different from what other states require. Counties have added additional documentation requirements based on fears that the state might disallow some services because of the interpretations of the guidelines and audits. SB 296 will solve this problem by requiring the State Department of Health Care Services to develop a single set of billing documentation requirements for the provision of specialty mental health services by January 1st, 2017, for use commencing on July 1st, 2017. This bill would also require the department to update the requirements every 2 years and prohibit counties from requiring additional documentation that go beyond those developed by the department. I also agree with the amendments in the mock-up suggested by the committee. The amendments clarify that this bill only affects billing, documentation requirements for the provision of specialty mental health services. With that, I'm pleased to welcome the California Council of Community Mental Health Agencies as a sponsor and witness of SB 296.
Rusty Seelix, California Council of Community Mental Health Agencies, sponsor and support of this bill. I began advocating for community mental health agencies 28 years ago. At that time, agencies said that the paperwork burden represented a little over 20% of their costs. It's now between 40 and 50% of their costs. A big chunk of it due to these documentation requirements that seem to grow endlessly. Ultimately, this bill is a workforce bill because this is the #1 reason why we lose people to the system, and passage of this bill will, in effect, significantly expand our workforce because it'll increase the capacity of each clinician to do more work. With me is Leslie Preston of La Clinica de la Raza, one of our major providers, and give more specific information of exactly how these problems manifest. So what we're looking for is a way to bring the state and counties together to follow the lead of more than a dozen states that have gone through a process like this to streamline and simplify their paperwork burdens to what is necessary to comply with federal law and nothing more than that for billing purposes. Thank you.
Hi, my name is Leslie Preston. I'm the Behavioral Health Director at La Clinica de la Raza. In an effort to decrease waste in California's public mental health system care, it's time to reduce unnecessary and excessive paperwork, and SB 296 does this. Treatment providers are concerned about the escalating documentation demands that drain our resources from services to consumers and families. Fear of audits, lack of clarity of the federal requirements, and additional state and county requirements have resulted in where we are now, which is that up to 40% of our time is doing paperwork alone. SB 296 will direct our system to do the following. It will clarify the federal requirements, identify the additional state requirements, evaluate carefully the benefits and costs of the additional requirements on client care, on customer satisfaction, the cost of services, and regulatory compliance. It'll streamline our paperwork requirements at a state level to minimize county over-interpretation of the requirements. It'll also allow for greater compliance and greater consumer and provider satisfaction by reducing the time spent on non-direct client care. I've been asked to come and talk to you about a few examples. So I wanted to give you an example of something that affected our agency and a client that we were serving. A few years back, one of our charts was included in a state audit of the county, and we had one of the charts pulled as part of the county audit. The state review resulted in a finding that the developmental history for the child whose chart it was being reviewed was not sufficient, even though the chart showed the pregnancy information, the delivery information, the age of walking and talking, and that this child met all normal developmental milestones. In our current system, it's left to the counties to define what are the required elements, and they are hesitant to define the elements for fear that it will not meet the audit repercussions. So what do? We gather information that is way in excess of what is actually required. What we do right now is we gather an entire page of information solely on developmental history because we don't know what it is that is being looked at in the audit. This is a common practice. It's inefficient, it's costly, and it's way in excess of the federal requirements. This is only one of hundreds of examples of where this is occurring. There is a best practice called collaborative documentation, which programs across the country have been adopting for many years now. We worked with a national trainer to implement this practice, and after reviewing the California standards, he concluded that collaborative documentation cannot be fully implemented in California due to the excessive paperwork requirements, which are well beyond that which he had seen in any other state. SB 296 would reduce excessive and unnecessary paperwork requirements and result in more services to consumers and families by redirecting the time clinicians spend on these unnecessary paperwork requirements to provide clinical care, greater regulatory compliance, and improvement in workforce retention. I request that you vote in favor of SB 296. Thank you.
Thank you. Anyone else in support? Support?
My name is Maggie Merritt. On behalf of the Steinberg Institute, we're in support of this bill.
Thank you. Support?
Lucinda De Rossi, representing the California Association of Social Rehabilitation Agencies, serving over 75,000 individuals each year, and we are in support of this bill.
Thank you. Opposition? Seeing no opposition, question, comments from any of the members? We have a motion to move Senator Nguyen. I'll be supporting the bill. Would you like to close?
I just request an aye vote. Thank you.
Thank you. This is item number 8, SB 296, Canala do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Nielsen. Nielsen, aye. Pan. Roth. Wolk. Wolk, aye.
Currently has 4. We have members absent. We'll place that bill on call.
Thank you very much.
I believe Senator Morrell is next. Is that correct? I don't. Senator Morrell, welcome. How are you feeling? Better. You want to sit down or? Okay. I heard you weren't feeling very well.
I had a little bit of the cold, but I'm feeling better today, so that's good.
Well, welcome. We're at item number 9, SB 407, Comprehensive Perinatal Services Program, Licensed Midwives. Good afternoon and welcome.
Well, welcome, Mr. Chair, and good afternoon, committee members. I understand this committee has been very helpful in analyzing this bill, and I want to thank you for that. The committee has been offered amendments that we are ready to accept today, and you should have all that's been handed to you earlier. You can see the amendment in bold on page 3. SB 408 adds licensed midwives to the list of providers eligible to participate in the comprehensive services program under Medi-Cal. Licensed midwives provide comprehensive childbirth, prenatal care, and breastfeeding education to their parents. Studies have shown that women who receive these services have healthier pregnancies and less complications. Under current law, however, licensed midwives are not recognized as eligible providers of these benefits, which fall squarely within their scope of practice. SB 407 expands health care access to low-income mothers and gives them a choice. Expectant mothers of all income levels should have options when it comes to deciding where and how they bring their children into this world. Now, this bill does not expand a licensed midwife's scope of practice. In fact, we are adopting amendments today to make that very clear. This bill simply allows midwives who are licensed to provide the services to Medi-Cal recipients that are covered by the Comprehensive Services Program and that they are already authorized to provide to the general public. You should also know and receive a copy of a letter from the California Right to Life Committee removing their opposition from this bill. That was a misunderstanding and it's been corrected. With me today to testify in support is Sarah Davis with the California Association of Midwives and Ms. Gordon with the California Black Health Network. Go ahead.
Sarah Davis, California Association of Midwives. Good afternoon, Chair and members of the committee. Licensed midwives in California eagerly await the opportunity to provide high-quality prenatal care to low-income women and families, an opportunity which this bill will provide for by authorizing licensed midwives to be providers in the Comprehensive Perinatal Services Program. We can help fill the gap of maternity care providers in California and increase the percentage of women in California receiving prenatal care during their pregnancy, a percentage which is in fact dropping. As you know, high-quality prenatal care is fundamental to ensuring improved pregnancy and birth outcomes and reducing ER visits, as well as ensuring timely referrals to higher-level obstetric care when necessary. Licensed midwives provide specialized, individualized prenatal care to healthy women who are anticipating normal births. There is great consumer demand for prenatal care with midwives, including consumer demand from low-income women who are Medi-Cal recipients. However, under existing law, low-income women are denied options and access to maternity care services through the CPSP program with licensed midwives. This is an unfair and unjust denial of options and self-determination for women and families. The Comprehensive Perinatal Services Program provider coordinates prenatal care for pregnant women. The provider assesses the pregnant mother's nutritional and psychosocial status and provides additional referrals or services to other healthcare providers for those needs, as well as tracking the referrals. Every one of these services is central to the current practice of licensed midwives and well within the existing scope of practice in Business and Professions Code. Certified nurse midwives have been CPSP providers since the inception of the program, and we are pleased that the California Nurse Midwives Association is in support of this bill. We are thrilled for the opportunity to become Comprehensive Perinatal Services Program providers and respectfully ask for your aye vote.
Good afternoon, Chair and members. My name is Jasmine Gordon, and I'm a policy analyst at the California Black Health Network. The California Black Health Network is a statewide policy and advocacy organization established in 1978. Our mission is to improve the health status of people of African descent in California. We work to build healthy families and healthy communities throughout the state. SB 407 is very important to our organization because of the devastating infant mortality rates in the African American community. Despite national priorities to eliminate infant health disparities, Black infants are 2.5 times more likely to die in infancy compared to non-Hispanic white infants. 1 in 7 births to African American mothers was preterm, and the preterm birth rate is 1.5 times the rate among white mothers. This disparity is largely related to the greater incidence among Black infants of prematurity and low birth rate, congenital malformations, sudden infant death syndrome, and unintentional injuries. This greater incidence in turn is related to a complex interaction of behavioral, social, political, genetic, medical, and healthcare access factors. Thus, to influence the persistent racial disparity in infant health mortality, a highly integrated approach is needed, and we believe that SB 407 is the first step. Studies show that women who receive the various services offered by midwives during pregnancy have healthier pregnancies and less complicated births. The California Black Health Network believes that midwives will provide essential services to our low-income African American mothers and help to reduce the infant mortality rate of Black babies. Thank you, and I ask you for your aye vote.
Thank you. Anyone else in support? Opposition to the measure? Oh, support, okay. We can have all the support. Please state your name and position.
Amy Taylor of San Diego County. I support this bill.
Thank you.
Hi, I'm Jenny Maeda from San Diego, and I home birthed my 3 children, and I support 407.
Eileen Eno, San Diego. I support this measure.
Lacey Hall, San Diego. I birthed with a midwife, and I support this.
Victoria Eichert-Schreider, attorney for the California Coalition for Health Choice, and we support this bill.
Tanya Smith-Johnson, president of California Families for Access to Midwives, and I strongly support this bill.
Good afternoon, Senators. My name is Chantal Weierman. I am the mother of 2 children that were birthed via home with midwives, and I support this bill.
Bill Bautista, American Nurses Association of California, and we are in support of this bill.
Ms. Alessi, I'm a student midwife and a past Medi-Cal recipient, and I support this bill.
My name is Alexandra Rounds. I'm here from Mendocino County, and I support this bill.
Jessica Denning, Sacramento. I had a home birth with a midwife and a home birth doctor, and I support this bill.
Hello, my name is Victoria Phillips Larson. I'm a labor and delivery nurse and a California Nurses Association member, and I strongly support this bill.
My name is Chelsea Tibbs from Sacramento. I'm a mother and a law student, and I support this bill.
Michelle Trainer, Antioch, California, mother of 3, and I support this bill. Thank you.
Dr. Tara Zanfleet, physician in San Diego, in support.
Amber Beasley, mother of 2 boys, also had a midwife myself and would absolutely support others being able to have that ability.
Joel Bremson, Davis, California, I support.
Nina Tasillo, San Diego. I had a team of midwives help me birth my beautiful baby girl. Strong support.
Shauna Lambert, I'm a registered nurse in Oceanside. I had a midwife deliver my daughter, and I'm supportive of this bill.
Ruth Johnson from Costa Mesa. I had a midwife with both of my children.
Nicole Beck, Rancho Santa Margarita, mom of 2, and I support this bill.
Lee Cole from Oakland. I support the bill.
Ann Austin, Cardiff by the Sea, support.
Lourdes Gonzaga, Sustainable Health Advocate. I support this bill.
Rosanna Davis, I'm from Los Altos, and I'm also a licensed midwife. I support this bill.
My name is Amy Bauk. I'm from Nevada County, and I had a midwife deliver both my children. I'm also a labor nurse, and I support this bill.
Chris Thornton from San Diego, and I'm a birth doula, and I support this bill.
I'm Jessica Johnson. I'm a licensed midwife in the Central Valley, proudly serving low-income families, and I'm looking forward to supporting more. I proudly support this bill.
Leslie Nelson, licensed midwife in Davis, California, and we serve Sacramento, Solano, Yolo County, Colusa County as well, and I strongly support this bill. Thank you.
Hi, my name is Rochelle Ahmad. I'm a home birth mom and the Sacramento chapter leader of the International Cesarean Awareness Network, and we strongly support this bill.
My name is Kimberly Gibbs-Egan from Campbell, California, and I had 4 children with midwifery care, and I strongly support this bill.
My name is Daniel Gibbs-Egan, and I support this bill. My name is Liam Gibbs-Egan. I was born at home, and I oppose this. Support this bill.
My name is Katrina Gibbs-Egan, and I support this bill.
Hello, my name is Amanda Carrillo from El Dorado County, and I support this bill.
Hello, Kirsten Branch from Danville, California. 2 children delivered by midwives. Support the bill.
My name is Nicole Rafferty from Mission Viejo, California. I strongly support this bill, particularly as a healthcare option for minority women in California. Thank you.
Hello, my name is Jessica Gutierrez Miller. I'm from Mission Viejo, California, and I strongly am for this bill.
Hi, my name is Maria Rivera, and I'm from Yorba Linda, California, and as a Hispanic voter, I support this bill.
Hi, my name is Julie Bingham. I am from Sacramento, California, and birthed both my children with a midwife. I support this bill.
I'm Kim Lautzenheiser, Orangevale, California, and I support.
My name is Terrell Weideman, mother of 2. I support this bill.
Cara Rose, Los Angeles. My son was delivered by a midwife. It's cost effective, and it has a great track record as far as a good outcome. So I think it's just the wise thing to do.
Can I try?
And I support this bill.
Can I try?
Hi, Polly Von Thaden, Dixon, California. I support this bill.
Mark Marthaler from Sonoma, California. Read much on midwives. I believe it's a good idea. I support this bill.
My name is Tristan. I'm born with a midwife, and I support this bill.
Irina Chertkov, mother of 2. I support this bill.
Cece Clark, mother of 3. I support this bill.
I'm Ann Colton from Sunnyvale, and I support this bill.
Hi, I'm Carrie Lewis from Lakewood, California, and I support this bill.
Thank you. Any opposition?
Good afternoon. I'm Shannon Smith-Crowley, representing the American College of Obstetricians and Gynecologists for California. We have an opposed unless amended position, but we are actually fine with the bill moving through this committee while we work. The author's office and sponsors have been very good to work with us. Our issues are mainly technical, so I just kind of wanted to be on the record about this. Right now, let me back up a little bit. ACOG spent considerable time in my stomach tissue on sponsoring AB 1308 a couple of years ago to re-regulate licensed midwives to remove barriers to practice. We are not opposed to the practice of licensed midwifery, and with this bill, we actually think our preference would be for alternative birth center births over home births. And this bill would promote alternative birth center births. We also, in terms of speaking to the issue in terms of the Black infant data, is we were one of the coalition led by the March of Dimes to get $4 million put back into the Black infant health program last year because the impact of infant mortality in that community is so devastating. So we understand when the program was able to get refunded. So the questions we have are whether or not the licensed midwives are able to, within their scope of practice, supervise all of the professionals that are providers within the CPSP program. And there's a little bit of a confusion about CPSP providers versus participants. We think as per they probably would not fit as providers in subsection A, but they would in E. And that would allow them to get paid for their own services. The other reason why this is important for them to be under this code section and be CPSP providers is because the alternative birth center licensure law requires them to be CPSP providers. I've looked at the legislative intent of the bill that put that in, and it's kind of an omnibus bill about other things, and it has nothing in any of the committee analysis about why you would tie birth center licensure to CPSP participation, because CPSP services are provided during the course of the pregnancy. So that's actually another avenue is to look at, and I've actually talked to DPH, and perhaps there can be more discussions with them about why is there this tie to alternative birth center licensure. So that would be something else that we're going to work on. But again, I appreciate working with the author's office and the sponsors, and we hope to have a resolution by the time we get into Assembly Health.
Thank you very much. Anyone else in opposition? Seeing none, questions, comments? Senator Wolk?
Yes, I'd just like to make a comment. I support the bill strongly. I'm a co-author, of course. And from what the ACOG representative says, it sounds to me like you're going to be in agreement shortly. So I think it's just important that you keep working together and work through some of those issues that I think can be resolved easily. So I'd be glad to move it when move the item.
Sure. We have a motion by Senator Wolk. Any other questions, comments? Seeing none. Oh, there you are. Chair recommends an aye. Would you like to close, Senator?
Respectfully ask for an aye vote.
For item number 9, SB 407, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Aye. Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Aye. Roth, aye. Wolk.
Aye.
Wolk, aye.
We currently have 6, enough to get out, but we have some absent members. We're going to put that bill on call.
Thank you.
Senator Allen, item number 10, SB 447, Medi-Cal clinics, drugs, and supplies. Good afternoon, Senator, and welcome.
Thank you.
You can stand up if you want.